Distorted media messages. When a scientific study related to health is published, especially about food like chocolate, mass media often tends to oversimplify or even distort the information to attract attention. Headlines like, "Eat chocolate every day to prevent stroke," easily grab readers' interest but misrepresent the true nature of the research. In reality, the health benefits are primarily associated with pure cocoa, which is rich in natural antioxidants called flavonols, not with commercially processed chocolate filled with sugar and fat. However, many food companies take advantage of these studies to market their products, leading the public to believe that all types of chocolate are healthy. This kind of inaccurate media reporting not only causes misunderstanding, but also directly affects consumer behavior. People may make unhealthy choices based on misleading information. Therefore, the public needs to approach health news with critical thinking and awareness, protecting their well-being instead of following sensational and distorted messages. Flavonols in cocoa are beneficial for health. Flavonols are a group of naturally occurring compounds found in high concentrations in raw cocoa. These powerful antioxidants have been the subject of numerous studies due to their potential health benefits, particularly for cardiovascular health. Flavonols help improve blood flow by enhancing the function of the endothelium, the inner lining of blood vessels, thereby reducing blood pressure and improving circulation. Research has shown that consuming cocoa rich in flavonols can lead to short-term improvements in vascular function, such as better dilation of blood vessels and increased oxygen delivery to tissues. Over time, these effects may contribute to a lower risk of heart disease and stroke. Moreover, flavonols have anti-inflammatory properties and may help protect brain health by supporting blood flow to the brain. However, it is important to distinguish between pure cocoa and commercial chocolate products. Many chocolate bars contain added sugars, unhealthy fats, and undergo processing methods like alkalization, which significantly reduce flavonol content. For health benefits, it is best to consume natural, non-alkalized cocoa powder, preferably added to healthy foods like smoothies or oatmeal. When used properly, flavonol-rich cocoa can be a delicious and functional addition to a balanced diet. Effects on blood vessels. Cocoa flavonols have shown a remarkable ability to positively influence the health and function of blood vessels. One of their key benefits lies in improving endothelial function, the ability of the inner lining of blood vessels to relax and regulate blood flow. Flavonols stimulate the production of nitric oxide, a molecule that helps dilate blood vessels, reduce blood pressure, and enhance circulation throughout the body. This improved vascular function is not just theoretical. It has been demonstrated in both short-term and long-term studies. For example, within hours of consuming flavonol-rich dark chocolate or cocoa, participants in clinical trials experienced measurable improvements in blood vessel dilation. In people with conditions such as peripheral artery disease, this effect can lead to better walking endurance and reduced pain during exercise due to enhanced blood flow to the limbs. The impact may also extend to the brain. Healthier, more flexible blood vessels can improve cerebral circulation, potentially lowering the risk of stroke and supporting cognitive function. However, these benefits are only associated with high flavonol cocoa, not with sugar-laden chocolate products. For optimal vascular health, incorporating natural, minimally processed cocoa into the diet may be a heart-smart choice. Cocoa and atherosclerosis. Atherosclerosis is a condition characterized by the buildup of plaque inside the arteries, leading to narrowed blood vessels and reduced blood flow. This condition increases the risk of heart attacks, strokes, and other cardiovascular problems. Recent research has suggested that cocoa, particularly rich in flavonols, may play a protective role against the development and progression of atherosclerosis. Flavonols in cocoa help improve endothelial function, reduce oxidative stress, and lower inflammation, all of which are key factors in the formation of arterial plaque. By enhancing nitric oxide production, cocoa flavonols promote better blood vessel dilation and flexibility, making it harder for plaque to accumulate and arteries to stiffen. Some studies have even shown that regular consumption of flavonol-rich cocoa may help slow the progression of atherosclerosis, or in rare cases, slightly reverse early stages of the disease. Additionally, cocoa has been associated with improved cholesterol profiles, such as reduced LDL, bad cholesterol, and increased HDL, good cholesterol. However, these benefits are linked to natural, unsweetened cocoa and not processed chocolate products high in sugar and fat. To support arterial health, incorporating raw or minimally processed cocoa into a healthy diet could be a delicious and heart-smart habit. A humorous study in Scotland. One of the most amusing examples of nutrition research comes from Scotland, where scientists explored the cultural phenomenon of the deep-fried Mars bar, a snack strongly associated with Scottish fast food. Published in the Scottish Medical Journal, the study set out to determine whether this infamous treat was a myth or a reality. Researchers called over 600 fish and chip shops across Scotland and discovered that more than 20% actually sold deep-fried Mars bars, with some outlets serving up to 200 per week. The study, though lighthearted on the surface, was tied to a serious health concern: Scotland's high rate of stroke and cardiovascular disease. As a humorous twist, the researchers even compared the vascular effects of eating a deep-fried Mars bar to those of a Mediterranean-style meal like oatmeal. Unsurprisingly, the results were not in favor of the Mars bar. This blend of humor and science helped highlight the connection between dietary habits and national health. It also served as a clever reminder that cultural food traditions, while often fun and beloved, can have real health consequences. Sometimes, a little laughter and research can make serious health messages more memorable and impactful. Population studies. Population studies are a cornerstone of public health research, providing valuable insights into how different factors, such as diet, lifestyle, genetics, and environment, affect the health of large groups of people. These studies typically follow a specific population over time, tracking various health indicators like disease prevalence, life expectancy, and behavioral trends. By examining diverse groups, researchers can identify patterns and correlations that help establish evidence-based recommendations for improving public health. For example, a population study might track the eating habits of thousands of people across different regions and correlate these habits with the incidence of diseases like diabetes or heart disease. Such studies help to distinguish the effects of individual risk factors from those of broader societal trends. They also provide a comprehensive understanding of how different factors, such as socioeconomic status or access to healthcare, influence overall health outcomes. One of the strengths of population studies is their ability to reveal trends that are not immediately obvious in smaller-scale experiments. While individual trials are valuable, they often can't capture the complexity of real-world conditions. Ultimately, population studies help shape health policies, inform preventive measures, and guide public health interventions to improve the well-being of entire communities. Challenges in long-term research. Long-term research studies are essential for understanding the lasting effects of various factors on health, behavior, and other outcomes. However, conducting these studies presents several significant challenges. One of the primary difficulties is participant retention. Over the course of several years, or even decades, it can be hard to keep participants engaged and committed to the study. People move, change contact information, or simply lose interest, leading to dropout rates that can affect the reliability of the data. Another challenge is the changing nature of environments and variables. Over long periods, societal trends, technological advances, and even climate conditions can alter the conditions under which the research is being conducted. These changes can complicate the interpretation of data, making it harder to determine what factors truly influence the outcomes. Moreover, funding and resources can be a limiting factor. Long-term studies require consistent financial support, infrastructure, and personnel, which are not always guaranteed over extended periods. Ethical concerns, such as maintaining participant privacy and consent over time, also need to be addressed. Despite these challenges, long-term research is invaluable in providing insights into chronic diseases, aging, and long-term health trends, offering essential data for making informed public health decisions.